Before you use your Medicare card for these 5 bills, check this first, because many seniors do not find out Medicare says no at the front desk. They find out after the appointment is finished, after the eye exam is done, after the dental work is discussed, after the hearing aid price is on the table, or after the family is already trying to figure out who is going to pay for care. Medicare is important coverage. It can protect you from many serious medical costs, but Medicare does not mean every health-related bill is automatically paid. Some bills that feel routine, necessary, and obvious to a senior may still fall outside what original Medicare covers. So in today's video, I'm going through 5 bills Medicare may not pay, why these bills surprise so many people, and what you should ask before that bill reaches your mailbox. And when I say do this first, I mean 3 things before the service is done. Ask how it will be billed, ask whether your specific Medicare coverage pays for it, and ask what your estimated out-of-pocket cost could be if Medicare says no. Please stay with me until number 5, because that one is not just a small office bill. That one can affect your savings, your home, your adult children, and your entire retirement plan. The goal is simple. Before Medicare says no, you know what to do first. Now, before we get into the 5 bills, let's make this very clear. This video is mainly about original Medicare, which is Medicare Part A and Part B. Part A is your hospital insurance. People usually connect it with inpatient hospital care, skilled nursing care in certain situations, hospice care, and some home health care. Part B is your medical insurance. People usually connect it with doctor visits, outpatient care, preventive services, medical supplies, and certain medically necessary services. So Medicare does cover a lot. The expensive misunderstanding starts when a senior hears the word medical and assumes the bill is automatically covered. Some services may feel medically important, but Medicare may still treat them as routine, custodial, or outside the coverage rules. Eyes, teeth, hearing, yearly checkups, and long-term care do not feel like luxury problems when you are older. But Medicare rules do not always follow what feels obvious. Some Medicare Advantage plans may include extra benefits. Original Medicare does not cover, like certain dental, vision, or hearing benefits, but those benefits can come with networks, dollar limits, co-pays, and restrictions. Also remember, plan benefits, dollar limits, networks, and costs can change from year to year, so never rely only on last year's booklet or what a neighbor's plan covers. Always confirm with your own plan before the appointment. So before you schedule anything, ask the office one simple question. Is this covered by my specific Medicare coverage, and what will I owe if Medicare does not pay? That question can save you from finding out after the bill arrives. The first bill Medicare may say no to is routine vision care. And this one surprises people because eyesight does not feel optional when you are older. You need your eyes to read prescription bottles, drive safely, see stairs, read bills, and understand the small print on medical forms. So a lot of seniors naturally assume this is healthcare, so Medicare should help. But with original Medicare, routine eye exams for eyeglasses or contact lenses are generally not covered. Medicare also usually does not cover regular eyeglasses or contact lenses. Now, this does not mean every eye problem is ignored. That is the detail that changes the bill. If your doctor is testing or treating a medical eye condition, Medicare rules may be different. Part B can also cover one pair of standard eyeglasses or one set of contact lenses after cataract surgery that implants an intraocular lens. But that is not the same as walking in for a routine eye exam just to update your glasses. So before you schedule the appointment, ask the office this clearly. Is this a routine vision exam, or is this being billed as a medical eye visit? Then ask your plan what it pays for. Some Medicare Advantage plans include vision benefits, but you still need to check the limit. Does it pay for the exam, frames, lenses, contacts? Is there a yearly allowance? Do you have to use a certain eye doctor or optical shop? A vision benefit that sounds good on paper may not cover the full cost of the glasses you actually need. So do not wait until you are choosing frames to ask what Medicare will pay. Ask before the exam is done. The second bill Medicare may say no to is routine hearing care and hearing aids. And this one is not a small issue. When someone starts losing hearing, it does not always look like a hearing problem at first. It can look like they are ignoring people, getting confused, or pulling away from family dinners, phone calls, church, television, and normal conversations. But when the hearing aid price comes out, that is when many people get the shock. Original Medicare generally does not cover hearing aids. It also does not cover exams for fitting hearing aids. Medicare Part B may cover diagnostic hearing and balance exams if a doctor or other healthcare provider orders them to find out whether you need medical treatment. But that is different from routine hearing aid coverage. So before you schedule a hearing appointment, ask this. Is this test being ordered for a medical diagnosis, or is this for hearing aid fitting? That difference matters. Some Medicare Advantage plans may offer hearing benefits, but again, you have to check the details. Ask if the benefit is a real dollar allowance or only a discount. Ask if both ears are covered. Ask if you must use a specific provider. Ask if the hearing aid brand is limited. Ask how often the benefit resets. And if your hearing loss is mild to moderate, ask whether over-the-counter hearing aids are an option you should discuss with a qualified professional. The dangerous word here is included. Included does not always mean paid in full. So before you agree to a hearing aid, ask what your final out-of-pocket cost will be, in writing if possible. The third bill Medicare may say no to is dental care. And this is the one that makes many seniors angry, because a dental problem does not feel separate from your health when you are the person dealing with it. A broken tooth can affect how you eat. Bad gums can affect pain, infection, sleep, and confidence. Dentures, crowns, fillings, extractions, and implants are not small expenses for someone living on Social Security. But in most cases, Original Medicare does not cover routine dental services like cleanings, fillings, tooth extractions, dentures, or implants. Medicare may cover some dental services only when they are closely connected to certain covered medical treatments, but that is not the same as normal dental coverage. So slow down before you sit in the dental chair. If you have a Medicare Advantage plan, check whether dental is included. But do not stop there. Ask how much the plan actually pays per year. Ask if there is a waiting period. Ask if major work is covered. Ask if dentures, crowns, root canals, extractions, or implants are included. Ask if your dentist is in the network, because dental included can sound comforting until you discover there is a small yearly cap, and one crown uses most of it. Some seniors also look at standalone dental insurance, dental discount plans, dental schools, community clinics, or local low-cost programs. But a discount plan is only useful if dentists near you actually accept it. And before any major dental work, ask for a written treatment plan with the expected cost. Do not be embarrassed to ask. You are not being difficult. You are protecting your wallet. Because the worst time to find out Medicare will not pay is after the tooth has already been pulled, the denture has already been ordered, or the bill is already in your hand. Now, if the first three surprised you, the next one is different. This one is not about buying glasses, hearing aids, or dental work. This one can happen from using the wrong words at the doctor's office. A senior calls and says, "I need my annual physical," and they assume Medicare will treat that like a fully covered yearly checkup. But sometimes that one phrase can change how the visit is billed. Before we get into it, press like if this is helping you understand Medicare before the bill arrives. The fourth bill Medicare may not pay the way seniors expect is a full routine annual physical. A senior calls the doctor's office and says, "I need my yearly physical." That sounds normal and responsible. But under Medicare, a routine physical exam and a Medicare yearly wellness visit are not always the same thing. The word physical can turn what you thought was a free Medicare visit into a billable visit. Medicare covers a yearly wellness visit to develop or update a personalized prevention plan. But Medicare also lists routine physical exams among the services Original Medicare does not cover. A Medicare wellness visit is usually focused on your health history, risk factors, medications, screening schedule, and prevention plan. But a full routine physical may include a more complete hands-on exam, extra blood work, extra testing, or services that may be billed separately. They think they are going in for the free Medicare visit. Then they mention a new problem, ask for extra labs, request a full physical, or the office bills something differently, and suddenly the visit is not as free as they expected. If the doctor handles a new complaint during the same visit, that part may be billed separately. So when you call, do not just say, "I need my annual physical." Say this instead, "I want my Medicare annual wellness visit." Then ask the office, "Will anything during this appointment be billed outside the wellness visit? Will blood work be separate? Is this preventive, diagnostic, or routine? Will my Part B deductible or coinsurance apply?" This does not mean you should avoid care. It means you should understand how the appointment is being billed before you are surprised later. One word at the front desk can change the bill. So before you walk into that exam room, make sure you are asking for the Medicare visit you actually want, not the phrase that accidentally puts you into a different billing category. The fifth bill Medicare may say no to is the one that can do the most damage: nursing home care and long-term care. Many families get shocked because they hear the word nursing home and assume Medicare will step in. But Medicare does not work that way. Medicare may cover short-term skilled nursing facility care in certain situations. For example, after a qualifying hospital stay, if you need daily skilled care, therapy, or rehabilitation, and you meet Medicare's rules, Part A may help for a limited time. But that is very different from long-term custodial care. Even when Medicare helps after a hospital stay, that does not mean it pays forever. Skilled nursing facility care is short-term, conditional, and tied to skilled care rules. In some cases, it may be covered up to 100 days in a benefit period, but that is not the same as years of help with daily living. Custodial care means help with normal daily living: bathing, dressing, eating, using the bathroom, getting in and out of bed, remembering medications, staying safe when someone can no longer live alone. And this is the care many seniors actually need later in life. But if the main need is help with daily activities and not skilled medical care, Medicare may say, that is long-term care, and the bill may become your responsibility. A senior can have Medicare. They can have a Medicare card. They can have worked for decades. But that does not mean Medicare will pay for years in a nursing home, assisted living facility, or regular home care help. And this bill does not just affect the senior. It affects the daughter who starts missing work, the spouse who is already exhausted, and the adult child who suddenly becomes the caregiver, driver, cook, and bill organizer. It affects the family home, savings account, and retirement plan. That is why this bill feels different. Glasses, dental work, and hearing aids can hurt, but long-term care can change the family budget. Now, there may be options. Medicaid may help with long-term care if the person qualifies under their state's rules. Some people buy long-term care insurance earlier in life. Veterans may have separate programs. Some families speak with an elder law attorney before a crisis. Some communities have aging agencies, home care programs, or caregiver support services. But the mistake is waiting until the discharge planner says your loved one cannot safely go home. At that point, the family is tired and the choices may be limited. So ask early. If I ever need help bathing, dressing, eating, or living safely at home, who pays? That is the Medicare question most people avoid. But avoiding it does not protect your money. Medicare may cover short medical recovery. It may not cover years of help with daily life. And before you assume your plan has you covered, call and ask directly. Do not ask, do I have nursing home coverage? Ask, does this pay for long-term custodial care if I only need help with daily living? So, before you use Medicare for any of these 5 bills, slow down and ask the question before the service is done. Do not wait until the bill is already printed. If it is vision care, ask if it is routine vision or a medical eye visit. If it is hearing care, ask if the test is diagnostic or just for hearing aid fitting. If it is dental care, ask whether your plan actually covers the procedure, what the yearly limit is, and whether your dentist accepts that coverage. If it is a yearly doctor visit, ask whether you are scheduled for a Medicare annual wellness visit or a full routine physical exam. And if it is nursing home care, rehab, assisted living, or help at home, ask the hard question directly. Is this skilled medical care or is this long-term custodial care? Because those words can decide who pays. Also ask your plan. Is this provider in-network? Is there a dollar cap? Is there a waiting period? Will I owe a deductible copay or coinsurance? Can I get an estimate before the appointment? And if Medicare or your plan does not cover it, ask about other options before you give up. There may be local programs, dental schools, state assistance, Medicaid options, veterans benefits, nonprofit clinics, or lower cost providers. The worst time to learn Medicare says no is after the service is already done. So check first, ask clearly, and get the answer before the bill reaches your mailbox. If this helped you avoid a Medicare bill most seniors only learn about too late, press like, subscribe to Seniors Heaven, and stay with us for plain English updates on Medicare, Social Security, taxes, and senior benefits that can affect your monthly money.